Hello, I'm Joe Hannell from the Colorado Health Institute, and I know there's been a lot of talk this year about the hospital provider fee and Tabor. I also know this is a really arcane, confusing topic, so we here at CHI have prepared a short little animation to hopefully help you understand what's going on when people are talking about the hospital provider fee and the Taxpayer's Bill of Rights. So give us just 2 minutes, you're going to be an expert in this area. You ready? Here we go. We start with hospitals and the federal government. They both have some money. Now, in 2009, the legislature created the hospital provider fee, which does just what it says. It's a fee on hospitals, about $700 million these days. And it attracts federal matching money, bringing the total to around $1.5 billion. At this point, the feds go away, the state comes in, takes some of that expanded pot of money to pay for Medicaid expansion and administration, which makes the state government happy. Hospitals get everything they paid back and a whole lot more in the form of higher compensation for the Medicaid patients who walk through their door and paying for the charity care that they'd been writing off. That also makes the hospitals pretty happy. Now, at this point, though, we need to talk about the Taxpayer's Bill of Rights, Tabor. Tabor, as if you've lived in Colorado, you know it is a limit on how much government can grow, and it's based on inflation plus population growth. And it really only comes into play when the economy has been good for a few years, as it is now. When the state goes over inflation plus population growth, it's said to be above the Tabor limit, and that must be refunded to taxpayers. Now, not everything is subject to the Tabor limit, but the general fund is, and certain other revenue, including the state's portion of that hospital provider fee. Without the hospital provider fee, the state's under the Tabor limit, bring it in, and the state gets pushed above the Tabor limit, and it requires a refund. And that refund doesn't come from the provider fee, it comes from the general fund. That makes some legislators unhappy and makes hospitals pretty concerned, because this program they've come to know and love is now being blamed for causing cuts in the general fund, leaving less money available for schools and colleges and everything else. So there you have it, the hospital provider fee and Tabor in less than 2 minutes. If you like the clip, please feel free to spread the word, share the link, and we will see you around the Capitol this spring.